Smart Movers, welcome to Smart Motion. My name is Anna, this is Valeria, and today we're going to talk about how to prevent knee injury. So the first thing we need to know to prevent knee injury is how to align our hips, knees and toes when we're doing certain movements like squatting, turning or high impact like jumping. So we're going to look at a normal squat. So now I'm going to ask Valeria to just squat, not deep squat, just normal squat. Perfect. So if you see here, her knees are behind her toes, more or less mid-foot. Then her hip, knee, and second toe are following the same line. Something that we will need to correct is if her knee goes inwards. So yeah, exactly. So we will need to strengthen hip muscles, external rotators to try and follow the same line. If you're one of those people whose knee goes inwards while you're squatting, you can have a go to the next exercises I'm going to show you to correct that. Squat, this is the crab. Every time she steps, she's going to try to keep her kneecap above second toe and making the strength from the hip. Squeeze your bum. There you go. Well done. So the second exercise you can do to improve that alignment when you're squatting is the clamp. So you're going to lie on your side. Make sure your heels are aligned with your coccyx. Keep your heels together. Now squeeze your bottom to open your knee and make sure that your hip is not tilting. Good. And down. Right up. Go as high as you can without tilting. There you go. Squeeze there your bottom and down. Go. Do the exercise slowly and try to squeeze your bottom up and down. Good. So now we're going to go to a squat in a second position. So toes are pointing out and then you're going to try to squat following your patella wherever your second toes are. So in this case, her patella or kneecap has to fall above her second toe. Perfect. If it happens that your knee goes inwards and you don't have good hip flexibility, you just have to correct the foot, bring it in so you don't damage your knee. To improve that second position, you can then do the following exercises to improve your hip flexibility and get more external rotation. Okay, so what you can do to improve your external rotation on your hip, you can do some mobility exercises for your hip to try to improve that external rotation. So Valeria is going to do stretch now. Go on, put the baby position. Yeah. She's holding her foot and her knee, and she's going to swing her hands side to side, trying to get to the range, to the limit of the range, side to side. Try to do it repetitive and slowly, so it's warming up the joint. After doing this exercise for a little bit, she's going to get into a pigeon position. So the importance of this exercise is to keep both hips parallel to the floor. If you have more flexibility, then you will be able to put your leg a bit more like a forward position. But if not, like in her case, you just bring it towards you and make sure that both hip bones are parallel to the floor. Tighten your tummy and round your pelvis the other way around, pelvic tilt. There you go. Go and try to breathe into the stretch, pushing down into the hips. Good. So the third movement we're going to look at is a single leg drop or single leg squat. So in this single leg squat, we need to look at the hips, hip bones at the same level, and hip, knee, and second toe in the same line. So Valeria, can you do a single leg drop? So if you see here, her knee is not passing her toes. Her kneecap or patella is above her second toe. Same thing with the hip. Both hip bones are at the same level. To improve any single leg activity, you need to improve your hip stability by strengthening your glute med. How to strengthen that muscle? Make sure you are aligned so your shoulder, hip and knees in the same line. And now the exercise will be, she's gonna lift the leg, do a hip abduction. Make sure you're not using the side of the leg. So make sure you bring your leg back, really back, yeah. Straighten your knee fully and down again. So from here, you squeeze your bottom and lift and down. Make sure you're not arching your back, contract your abdomen, contract your tummy muscles, pelvic tilt, knee back, go up and down. Your foot has to be pointing forwards, your knee has to be pointing forwards, and there you activated your muscle, really good. So then you go up and down in that position, up and down in that position. If your leg wants to go forwards, that means you're compensating. So make sure you squeeze your bottom, bring it back, and go up and down. Second exercise to strengthen your glute med. You're gonna stand up and sit down using one leg only, following the second toe, patella, hip rule. So your goal here is the hip not to go sideways, both hip bones in the same line. Okay, and the knee is not allowed to go in either. And down. Well done. So the last exercise we're going to practice today is very simple. You just have to stand on one leg. Good. She's going to do certain things that I'm going to ask her, making sure, keep them apart, making sure that both hip bones are in the same level. Knee is following the same line with the hip and the second toe. So can you reach forward? Reach, really reach. Good. Well done. Make sure that the kneecap is going up on your second toe direction. Sideways. Make sure both hip bones are in the same line. Good. To the other side. Well done. And forwards again. Yeah, control that knee. How to control that knee? By squeezing here on your hip. Okay. So sideways again. Well done. Next thing we have to look at is turning. So the main goal here is making sure that your kneecap or patella is always above your second toe while you're turning. As you're going to be following with your knee and your hip the position of your second toe. So when you finish turning, make sure that your patella is following the second toe. The other knee, patella is following the second toe. So you need to make sure you are really squeezing your bottom muscles. There you go. So your thighs can rotate. Just remember that for anything you do, rotating, jumping and landing, squatting with one leg, with two legs, different positions, different external rotation of the hip, you need to always follow hip, knee, and second toe line. If you have pronated foot or flat foot, you might need some insoles. If you have rotated tibias, then you will just have to modify the exercise. I hope you find this video helpful and you have a better understanding of why can your knee be hurting. So put in practice all these exercises and see you in my next video. Don't forget to like and subscribe. See you. Bye.